Welcome back. As we mentioned, that we celebrate the many women who have made their mark in different aspects of our lives as a country and as a continent. We talk to some of them today. At this particular hour, we speak to Dr. Siviwe Mila, who is a medical doctor who's passionate about innovative ways of delivering quality healthcare. She works to impact health systems at a larger scale beyond one-on-one patient consultations. She says, aside from her day-to-day practice of medicine through several hospitals and clinics, she also serves on the board of Medical Women Association of South Africa. Dr. Mila joins us now to talk about her work under the new normal, that is COVID-19. And a very good evening to you. Thank you so much for speaking to us, Dr. Mila. Happy Women's Day, by the way.
Hello, Tupiso. Happy Women's Day to you and the rest of women in South Africa.
So let's talk about, I want to start with COVID-19. I think it's about 24,000 health professionals that have been affected by COVID-19 as a result of being of a forefront of trying to battle this pandemic. How has it changed working for you as a doctor?
Yeah. Firstly, I'd like to send condolences to everybody that has lost their loved ones through this pandemic of COVID-19. COVID-19 has really changed the way we practice medicine specifically, and just how medicine is in the general world. For a practitioner, I have tested 4 times for the virus, and all those 4 times results came back negative. But that's 24 to 48 hours when you're waiting for the results. So much goes through your thoughts. So much goes like, if it's positive, what's going to happen in the household, at work, will there be someone to fill in for me? And unfortunately, some of my colleagues have tested positive and they have to be off duty for 2 weeks, sometimes even more. So this is changed how we act. I think the sense that you just see how people do it so quickly in the time of consultation. But at times there's not much that you can do. And unfortunately, some of the lost.
Okay. I am struggling to hear you, Dr. Mila, but let's give it another go. So, does it make you feel anxious about your safety, by the way, when you're doing this? I mean, I know it's your calling, you took the Hippocratic Oath to do this, to help people, but has it created a more anxious working environment for you as a doctor, given that there are things such as shortages of PPE, the environments that you find yourselves working in are not necessarily safe?
Yes, I don't know if you hear me now. Am I better? Try to increase my volume.
Yes, you can go ahead.
Okay. So the way of working is changed. I could literally say you are anxious when you go into work. The way you are so covered up, even in PPE, interaction with patients has changed a lot. And it's just come to a point where even with your colleagues, you're just afraid sometimes of doing certain procedures because you do not know what is going on in the person's system, if they've got the virus or not. However, what keeps us going is our commitment to save lives, our commitment to make it better. I mean, there are cases where persons, if they can't be the saturation sitting at about 60% of the day, you put them on oxygen and they're doing much better. Those are the cases that get us up in the morning to be able to go back to work, even if you're afraid, you don't know if you have the virus, you don't know if you bring back the virus, to a point where I need to wear my scrubs every day I go to work, and I need to come back and shower before I can even touch my daughter or say hi to anyone in the house. So it has made you a bit antisocial to people that you know. But however, we keep in the standards and also we keep in the procedures that we need to so that we can keep other people safe. Yes, the issues of PPE have been a major issue. However, I can say at the hospitals and the clinics that I've worked with, there has been adequate provision of PPE.
Do you feel that COVID-19 has provided an opportunity for people to appreciate better what the medical profession provides?
Yes, definitely. I think also what COVID-19 has done is that it has made us in medicine to think at a broader perspective and to think of doing medicine a different way than the traditional way of you just seeing a patient and touching them one-to-one. And also, I think people are more cognizant and they're a bit kinder to us as health professionals. You know, I remember this one time after a long day at work, I went to this one shop And literally, I was very much proud to Dr. Mila, and the manager was like, "Thank you for your service," and gave me like a pot of orchards, So it's those things that really keep us going and fueling, not just as doctors, but as nurses, as porters, that people understand that every single day you do not know what you're going to bring home, but you go out there so that you can help the people that need the help. Because when you are sick, so that's the time you're the most vulnerable. I don't care even if you've got money or not, but you're most time the most vulnerable. And to get people that see that pain and people that can speak to that pain, not just on this psychological element or the spiritual element, but also speak to the pain in terms of giving the physical help that you need to get better. That is one thing that was taken out of COVID-19. And what's just, I'd like to add as well, it's how sad it's been for our patients. So when someone comes in and with my family or so on, the last time that they see them is when they meet them. If unfortunately that person passes away, they cannot see their family ever again. And I think that's the biggest spoken about sadness that is going through the country. I think there will be a period of time where we actually see how much damage it's done to the relationship.
Dr. Mila, we obviously are speaking to you on Women's Day, and we're putting a spotlight on the plight of women in South Africa. Talk to us about the medical profession, what challenges you faced as a woman entering the medical profession, and the barriers that you feel still need to be broken.
So one of the biggest barriers is still having to prove yourself, especially as a Black female. I remember at university we would have conversations on how do you get accepted. We probably got accepted based on the quota in Black females. So you tick the boxes so that the university can sort of get points and to meet the quota. And unfortunately, that speaks to trying to doubt yourself and say that, did you really deserve to be here or not? And for a very long time, that was something that spoke to me, but I realized that actually I've got the capability and I literally am brilliant and I can do what I'm doing, and literally every day I can save lives. So I feel like for the girl child, so much emphasis needs to be put on self-belief and knowing that you can do it. And the reason that you are there, and while you are there, you've got the right to be there. And actually, you must do the best while you're there. One thing that I've noticed, and this is not to bash the male gender, but guys literally just go and say they can do it, even if they can't. But somehow we as women tend to overanalyze at times and to just always doubt ourselves and bring ourselves a bit lower than the capabilities that we have. So challenges at med school was always having to prove yourself. And once even you've also graduated, you'd get people that are like, you're too young to be a doctor, you can't be a doctor. I've been practicing as a doctor for 5 years now. And every time, you want to give your best service to someone, but they judge you on sometimes your gender and also the race of your skin color. And I feel like that's so unfortunate. But for those that have interacted with you, they'll be like, thank you. Actually, you know what? It's inspiring to see a Black female doctor in this practice because we've never seen one. And those are the stories that we continue to live for. And those are the stories that we try and continue to inspire South African women and just South Africans in general, that we are here, we want to build a country, and let us do it all together.
Dr. Mila, let's talk about inspiration. You, as a side hustle, as it were, are design scrubs with flair. And tell us about how you got into that business. And hopefully we can show our viewers what you do. We'll just put up a graphic there, something that you posted earlier on.
Oh wow. Thank you so much, Siviwe. So I always loved sewing back from the time I was in high school because I still had needlework back in the day. I don't think they have those anymore. And the nice thing about it was that I love always having a challenge of working with my hands, be it cooking, baking, sewing. And I remember in university, it was crunch time, the whole 6 years. You always was working, or you were working to either an exam or the practical exam or test, and there's not much time. So when I got my very first paycheck in 2016, I told myself I'm going to buy myself a sewing machine. And I just wanted to go back to the love of sewing and just making garments for myself. I remember making scrubs within a couple of months, and people liked them and wanted me to make them. So that's how Impilo Health was born. And it's been inspiring how we can make people look beautiful while they're at work. And even your clients and your patients, they're like, oh, well, doctor, you look beautiful. And when you are looking beautiful, you feel confident. When you're feeling confident, you feel your best. So that is what we are all about. And I'm glad that we can serve a South African woman.
Thank you so much. And thank you so much for speaking to us, Dr. Siviwe Mila, a medical doctor. All right, thank you.